Now to the executive order, and President Uhuru Kenyatta has established a 21-member committee to get Kenya ready for the looming coronavirus threat. The National Emergency Response Committee on Coronavirus will be chaired by the new Health Cabinet Secretary, Mutahi Kagwe, with 4 other Cabinet Secretaries as members. And as Sam Gituku reports, the committee is required to have the isolation and treatment unit at Mbagathi Hospital ready in a week's time, in addition to a raft of other measures.
It's been a month since the World Health Organization declared COVID-19 an international public health emergency.
I'm sorry that you find my responses underwhelming.
The government has been issuing statements of assurance to the public with little believability in action. And the president has yielded to what he terms compelling public interest to take charge and scale up the country's preparedness. The directive coming by way of Executive Order number 2 of 2020.
Having been appointed a Cabinet Secretary,
a 21-member National Emergency Response Committee on Coronavirus has been constituted to be led by new Health CS Mutahi Kagwe, alongside 4 of his colleagues, James Macharia, Rochelle Omamo, Monica Juma and Joe Musheru. Others are Council of Governors Health Committee Chair Enisiolo Governor Mohamed Kuti, Principal Secretaries Karanja Kibicho and Susan Mochache. Chief of Staff at the Office of the President, Nzioka Waita, will also be a member.
And I expect you to use your full skill and knowledge to help us achieve this particular objective, dealing and confronting with emerging challenges such as the coronavirus, and there is an executive order that I have signed today, which I expect you to begin implementing immediately.
The immediate task being to expedite the preparation of a national coronavirus isolation and treatment center, which the president wants ready in 7 days. Similar centers will be set up across level 5 hospitals and referral facilities in the country. They must be ready by mid-next month as per presidential orders. The committee will coordinate the country's preparedness, prevention and response to the threat. It is their role to coordinate capacity building of health workers to enable quick response should the virus get to the country.
our surveillance capabilities, in terms of our isolation capability, quarantining capability, if we came to it, the human capacity that we have in the ministry. And we are lucky because we are not short, we don't have a shortage in that area.
The team will be responsible for coordinating the preparation of national, county and private isolation and treatment facilities. It will coordinate the supply of necessary equipment, including testing kits, medical supplies and protective gear. The president appreciating the country's position as regional transport hub, saying 70% of travelers are usually on transit through the country. Given the economic threat the virus poses, Kagwe's team will be responsible for conducting economic impact assessment and developing strategies to mitigate the effects. For a strain that appears to overpower some of the biggest economies of the world, the team will coordinate assistance efforts both locally and internationally, specifically aid in form of financial, technical and human resources. While choosing not to take a position on whether to issue travel barriers against any of the affected countries, the new committee will be required to review entry into Kenya of any person or class of persons known or suspected to have traveled from a coronavirus-affected area. Sam Gituku, President TV.